Is spermicide always messy? What to know about residue? When it comes to spermicide, many people wonder about the messiness factor. The truth is, spermicide can leave some residue, but it really depends on the type and form you choose. There are several forms of spermicide available, including foam, jelly, cream, suppositories, and film. Each of these has its own characteristics when it comes to residue. For instance, foam and cream can feel wet or sticky and may leave a noticeable residue inside the vagina after application. On the other hand, suppositories or films tend to dissolve or melt, which usually means they leave less noticeable residue. The amount of residue can also vary based on how much you apply and the specific product formulation. Now, why does residue matter? Well, it can affect comfort and even the sensation during intercourse. Some people might find the residue to be messy or uncomfortable, while others may hardly notice it at all. To help minimize excess residue and improve comfort, it is important to follow the product instructions carefully. From a sexual health perspective, the residue itself is generally not harmful. However, frequent use of spermicide, especially those containing nonoxynol 9, can sometimes lead to irritation. Nonoxynol 9 is a common active ingredient that immobilizes sperm, but it can also disrupt the vaginal mucosa if used excessively. This disruption can increase the risk of infections, including sexually transmitted infections. Therefore, it is best to use spermicide as directed and avoid overuse. Spermicide is most effective when used in combination with other barrier methods, like condoms or diaphragms. These methods not only enhance effectiveness but also help contain any residue, which can reduce messiness. Using spermicide alone is less effective and may increase the risk of irritation if used repeatedly without additional protection. To summarize, spermicide can be messy depending on its form and the amount applied. While residue is usually mild, it can cause discomfort or irritation for some users. Proper use and following instructions can help reduce messiness and irritation risk. Combining spermicide with barrier methods improves effectiveness and may help with residue issues. Remember, frequent or improper use of spermicide, especially those containing nonoxynol 9, can increase the risk of vaginal irritation and susceptibility to sexually transmitted infections. Understanding these points can help you manage your expectations and use spermicide safely and effectively within the broader context of contraception and sexual health. Always consult with a healthcare professional for personalized advice tailored to your specific needs.